Next, I will call our Chief Instructor, Dr. Jayanta Kuila, to deliver his talk on how to protect yourself from the hands of CPA.
Thank you, Dr. Shumona Chatterjee, for your interesting presentation. And now it will be the Chief Instructor, Dr. Jayanta Kuila.
Good morning, everybody. The armor of God, how to protect yourself from CPA. There is no financial disclosure. Corporatization and commercialization of medical profession against the spirit of Hippocratic oath. So doctors are no longer regarded as infallible and beyond questioning. Well-publicized malpractice case can ruin the doctor's career and practice. The best way to handle medico-legal issues is by preventing them. Negligence by doctors has to be determined by judges who are not trained in medical science. So the level of negligence depends on the entire context, the place, the time, the individuals involved, and the level of complications. It is important, error in judgment is not a negligence if it is recognized promptly and remedial actions is taken. But failure to do so tantamount to negligence. The duties which a doctor owes to patient, whether to undertake the case, what treatment to give, and administration of that treatment. A breach of any of these duties gives a right of action for negligence to the patient. Victim can seek one, compensatory action, punitive action, disciplinary action, or recommendatory actions, means lodging complaint before the National or State Human Rights Commission seeking compensation. Common errors in medical profession. Patients sue because of feeling that they are not heard, that their needs were not attended, and that nobody seemed to care. As a result, bad outcome resulted due to a mistake or negligence. So most important is communicate clearly and effectively. Ensure your patient understands their diagnosis, treatment, and medication. Failure to diagnose. Number one reason, a physician gets sued for medical malpractice. A techno-savvy patient may give or explain or ask more information, or patient may withhold the information and make diagnosis difficult. If a certain complication is a known risk, it should be on the consent form for the medical procedure. However, the consent form need not list every single complication that has ever occurred for that procedure. Be aware of all medication that patient is taking, including over-the-counter medication and alternative medicines. If patients feel any medication is not having its intended effect, they should immediately contact their physician and avoid handwritten prescriptions. So inadequate follow-up. Patients do not follow through the test as directed. Needing better follow-up involves referral to specialists. Every step has to be documented not only to prevent medico-legal issue but also for good patient care as well. So prevention is most important. So compassionate gestures count, so never avoid your patient. A time spent allowing the patient to fully explain his or her concern determines the physician's ability to show concern, empathy, and likability. So the longer quality of time a physician spends with the patient, the less likely will that physician be sued. always to do the best. And apologize. When physicians are honest about medical errors and apologize to the patient, the overall cost of medical malpractice is reduced in the end. One should refrain from blaming other healthcare providers for adverse outcomes. So that one must follow the proper clinical guidelines systematically developed nationally and globally to assist clinical decision making. So please practice of evidence-based medicine. They can be seen as normative standards and are used as explicit standards of care at the time of index clinical event, and also to assess the degree to which questionable practice was in line with accepted standards. Physician needs to stay up to date with the latest continued medical education programs, conferences, workshops, and symposium. Often patient may discuss what is in the social media. The ability to discuss about those news with your patients will reinforce their confidence. Another most important, informed consent and documentation. Always follow the proper surgical protocol, detailed notes of operation. Always sign along with the OR nurse in prescribed format for every operation. During surgery, if find something unexpected, it is advisable to explain your plans to the patient party before proceeding further. Always check pre-anesthesia assessment records. Correcting medical records is permissible, but fabricating or manipulating is both illegal and unethical. And if found by court, the consequences are disastrous, as the doctor loses all sympathies of the court. Avoid stress. While in the midst of malpractice case, one needs to stay focused on other areas of your life. Obsessing over the case should be avoided. Hospital policies. If the physician follows proper hospital policy regarding treatments and protocols, they are less likely to get into trouble. If diverted from regulations and hospital rules in managing the patient, the facility is less likely to defend. Two types of professional indemnity, one personal and another is errors or omission policy, covers on institution along with his staff member. Not only does a malpractice lawsuit reduce the physician's ability to make a living in medicine, but also it can adversely impact or devastate both earned and invested asset. Not everyone who sues has a case. In case of medical negligence, the patient must establish his or her claim against the doctor. A doctor can be held liable for negligence only if one can prove that he or she is guilty of a failure that no doctor with ordinary skills would be guilty of if acting with reasonable care. A reasonable doctor should consider every patient as a potential litigant. So always stick to a standard of care and avoid any adventurous attempt. So what is contributory negligence? If the patient refusing to carry out the treatment recommended by the doctor or indulging in activities forbidden by the doctor further exacerbates the damage. When there is negligence of two or more persons towards the patient resulting in a particular damage, it is called composite negligence. Media trial, a doctor cannot become a victim of malicious or defamatory reporting. A doctor should not be silent and should rebut the allegation. Doctor can take help of the professional association to convey the facts and supports to resist a trail of media. The Supreme Court has warned the police officials not to arrest or harass doctors unless the facts clearly come within the parameter laid down in a case. So at the end, practice is like driving through a accident-prone highway. Make sure that there is a competent driver. That means stay within limits of your expertise. Ignition means informed consent is working fine. Engine oil and fuel means documentation or medical records are enough for the journey. And GPS means communication, setup done. And brakes, know when to stop, working fine. Thank you.
Thank you, Dr. Jayanta, for your excellent presentation. Being a director of 2 hospitals in West Bengal, he has almost covered the entire topic of this today's